Hello, welcome to day one of my series for healing whiplash and increasing neck mobility. I'll be working on the lovely Mia today. Let's go ahead and get started. So since this is day one of the series, I'm starting off very gently. So I am going to go ahead and just place my hands. I don't have any oil on my hands, so I'm going to go ahead and start with a nice just static hold. And this is a really nice way to just help calm the nervous system, kind of introduce myself. And I'm going to go ahead and start with some just gentle scalp. So as I massage the scalp, I'll kind of talk about like how I think about a progressive type therapy plan for somebody that's had more severe whiplash. Usually there's going to be a lot of swelling in the neck and sometimes, the upper back as well, the shoulders. And unfortunately, you can't really do a whole lot of deep tissue work when there's swelling. So whiplash is kind of a tricky thing to try and work through. So you do have to start off really gently. And I'm talking about like the more severe cases. And also keep in mind that somebody that has whiplash, their nervous system is on overdrive, and there's probably still, extra adrenaline. And I'm used to working on people that have pretty recently been in not small accidents, car accidents. So the first step is just to kind of help the nervous system relax. But at the same time, you don't want to be like scared. You need to kind of have a plan and work towards deeper work if you can, especially in the neck. But I will usually, so this is going to be a 10 to 12 part series, and I'd say by, day 4 or 5, hopefully we'll be ready for deeper work. And I'm always sure to explain that to my clients, because often they're just chomping at the bit to kind of like get healing over with. Let's get this done. And unfortunately, it doesn't always work that way. Definitely a process. So there's a lot of nerve endings on the scalp, and this is just a really gentle way to just soothe the nervous system. And usually somebody with whiplash, they're in some amount of pain, so you don't want to just spend, a half hour doing a scalp massage. You want to be efficient with your time so that your client feels like they're getting the most out of their time with you. So I'll just kind of take maybe 5 or so minutes to just work on the scalp, and then start thinking about the muscles a little more. So I'm actually gonna start working on the soft tissue on the head a little bit more, so less focused on those nerve endings and more focused on that soft tissue now. So I'm actually seeing Mia's skin kind of move as I cross that hairline, and just working that soft tissue on the frontalis and really encouraging these temples to relax as well. And as I'm doing all this in real time, I'm actually just looking at the shoulders. I'm seeing if one shoulder is lifted, looking for any swelling in the shoulder area and even the pectoral area. And pretty much 10 times out of 10, you're going to see swelling in the upper traps and the SEM like all in here. So just kind of, once I get a visual cue, can go in a little more clearly. And this is usually when I'll kind of start realizing how quickly I can start moving and how aggressively I can work. And always with whiplash, it's better to err on the side of caution. Just really take your time. So just working on these temples. And sometimes when the nervous system is on overdrive, there's a tendency to clench the jaw. So I just encourage my clients to just feel that space in their mouth and let the tongue rest on the lower part of their mouth, especially as I'm doing this series, really encouraging a relaxed jaw. And honestly, whiplash, it does heal on its own, but getting this kind of work done definitely speeds things up and just helps to bring things into greater balance than you can do on your own. Just working on these temples, and I'm going to go ahead and check in with the occipitalis. And so I'm just holding Mia's head, and sometimes when the nervous system is jolted, it can increase anxiety in the body, and that doesn't mean that you're doing anything wrong. It's just the hormones, the adrenaline, the fight or flight response. And sometimes just working on these more superficial muscles, the occipitalis and the frontalis, just this really simple work can help with anxiety and just help calm everything down. So, and I'm never in a hurry with somebody that's dealing with more severe whiplash. Alright, so I'm going to go ahead and just walk my way down, and I'm going to walk my way along this occipital ridge with my finger pads, and I'm already feeling inflammation, so that's a contraindication to massage if it's extreme. Definitely deep tissue is out when you feel that swelling. So always encouraging my clients with whiplash to use lots of ice, ice 2-3 times a day really helps bring the inflammation down. Ice baths are great, even though they're really uncomfortable. So yeah, just working slowly and gently. And I'm gonna go ahead and just walk these shoulders out a little bit. I do a lot more static holds when I'm doing this kind of work, just because I don't know, I think they're good for the nervous system, just that constancy, that constant pressure, and you can get a really nice release too. So I'm just moving these shoulder joints around a little bit, and I'm gonna flush out these joints a little more as I get my oil. And really I'm just checking in to see if anything's locked in the shoulders, and they actually feel pretty good. So I'm gonna go ahead and just do a little work with the oil. And right now it might look like I'm just doing something kind of mindless, but I'm actually getting some movement in these shoulder joints and just flushing out the joints a little bit. There's synovial fluid that is just really good to stimulate and move around. I'm just flushing out these shoulders. This is usually something that you can do if there is a lot of swelling. It's just good to have kind of a game plan for how you're going to work around it. And I'm just going to work really lightly into the upper trap, just a little bit. So I'm really just giving me a kind of a little taste of what's to come, and just slowly and surely working through the swelling and the imbalances that happen as a result of the whiplash. And just making a conscious effort to work a little more slowly than normal. So right now I'm just kind of flushing out the SEM and being really gentle because of the swelling. And just the slow, compassionate touch, it really makes a big difference in calming down the nervous system. That's kind of always step one. And just a little stretch to finish. And that is all for today. Thank you for joining us today. I look forward to seeing you on day 2 of the series. If you did enjoy this video, we have a Patreon page where you'll find some really great content as well. I look forward to seeing you there.
Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by Psyche Truth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.